This is diseases of the 18th to 19th century and how to avoid them. I'm Carter Sway, and I'll be teaching about early colonial to early American history of diseases. Follow me on a medical journey through history. Some common diseases were colds, fevers, malaria, dysentery, and smallpox. Bad cases of colds and fevers would have most likely led to death. To avoid getting these, colonial people ate fresh fruits that would give them vitamins to boost their immune system. Some examples would be citruses. After they did that, they would be fully immune. Malaria and yellow fever were both carried by mosquitoes, so to avoid this, just stay away from mosquitoes. A way to avoid mosquitoes was to repel them using a rosemary tea. You can make rosemary into a tea and then apply it to your clothes and body. Smallpox was a contagious disease, meaning if someone had smallpox and you were around that person a lot, you would get that disease too. Later, I will be going over how you know if a person has smallpox. Dysentery was when you get an intestinal infection. This was common among sailors because not having proper hygiene and clean food is what caused dysentery. Of course, when you're on a boat for long periods of time, this is very difficult. You may be more susceptible if you stay in close quarters and you don't clean up. Rabies was curable in the 1800s. I quote Iowa State University's article on rabies in 1955, a frightful but not necessarily fatal madness, rabies in the 18th century England and English North America. The cure was first created in 1741 when John Neal was bitten by a rabid dog. He was taken to a hospital, and after a 2-week treatment, he was cured. The treatment, of course, was very crude, but it still worked. There are symptoms for all these diseases. Headaches, chills, sweating are common for fevers, colds, malaria, and yellow fever. You can also identify fevers by when you throw up and such. Yellow fever can easily be identified when your skin turns very yellow, hence the name yellow fever. To identify someone with smallpox, they will have small bumps, rashes, jabs, and they will be bleeding. A person infected with rabies will be delirious, dizzy, fatigued, scared of everything, and vomiting. Now that I have discussed how all these diseases work, I hope you are better prepared to avoid them. I hope you have better information about colonial diseases, and you know now, and you can teach people. This is Carter Slade signing off.